Technical Veterinary Learning TVL channel, founded and produced by Professor Ahmed Mamdouh El Sharif, Professor of Epidemiology and Infectious Diseases of Animals, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University. Animal infectious diseases caused by Clostridium species toxins. Malignant edema or big head disease or gas gangrene disease. It is an acute wound toxemic disease characterized by acute onset of fever, inflammation, swelling, and gangrene at wound site, deaths of infected animal. Pathogenic risk factor. Pathogenic risk factor is the Clostridium septicum, Clostridium shovii, Clostridium novii, Clostridium sordelli, Clostridium perfringens that contaminate 30 different types of open wounds in ruminants. Transmission done mainly during dirty opening wounds, during castration, docking, lambing, and so on. Sources of infection is the contaminated pasture with different Clostridium species. Animal risk factor. All ruminants are the animal risk factor with case fatality 100%. The animal risk factor are adult sheep with 6 to 8 months of age, where case fatality is 100%. Geographical distribution of malignant edema or gas gangrene disease. It is distributed throughout the world, with enzootic in the heavy producing countries or region for ruminants. Clinical picture: fever, dullness, depression, and etc. General toxemia signs. Disease occur within few days, 1 to 2 days. Local swelling and discoloration to the opened wound. Frothy bloody stained excretion with rancid odor from all the lesions. Deaths within 1 to 2 days post-infection. This picture demonstrates a contaminated, dirty open wound. A picture of a lamb showing edematous swelling of the head due to contaminated, dirty opened wound with Clostridium species. A swelled head of a lamb due to contamination of dirty opened wound with different Clostridium species. Prominent swelling of a head of an adult sheep due to contaminated, dirty open wound around his horns with Clostridium species. Post-mortem lesions. Gangrene of skin in affected wounds with gelatinous edema at subcutaneous and intramuscular connective tissue. Presence of erosions at small intestine. Serogenous fluid in different body cavities. Associated lymph nodes are enlarged. Post-mortem lesions. Congestion of small intestine. Presence of erosions at small intestine. Clear bloody stained fluid in different body cavities. They gave strands when exposed to the air. Rapid decomposition of the carcasses within 8 hours. Laboratory diagnosis. Clinical samples are aspirated fluid from lesions, blood from live animals, impression smear from site of the lesions. The laboratory tests are gram stain of impression smear, isolation and identification of the causative agent on anaerobic media, and toxin detection by neutralizing test. A picture taken from impression smear showing different clostridium species as gram-positive organisms from an open wound. Clostridium species appear as gram-positive organisms with spore appearance from impression smear of an open, dirty wound. Malignant edema or gas gangrene disease have to be differentiated from blackleg and anthrax diseases. Sources of infection is dead carcasses and fecal contaminated pasture. We keeping you on the right track, so please subscribe the channel to reach to the most newest knowledge about the epidemiology and different infectious diseases of different species of animals. See you later.